Hello, hello. I am Aaron Cunningham, and I'm going to present my presentation on my paper, The Effect of the Use of Probiotics on the Rate of Injury Healing in Burn Wounds. I hope that you will enjoy it. So to start things off, I would like to give a brief overview of what I'm going to be talking about during this presentation. I'm going to start on a background on burn injuries and probiotics, define the key terms, and give you the purpose of this research overall. I'm then going to talk about the methodology, how this study was set up, how my data was collected, and then I will go to organizational methods and how I filtered that data. I will then cover the test of validity I did on the studies that were produced by the methodology. I will then discuss the results of the methodology, the discovery phase of my research. I will then cover the discussion section of my paper, which has to do with the overall strength and limitations of my study overall, and I will conclude with a brief summary of what I've done. So the first thing I would like to talk about is the background. Why is this research important? So the start of that is why burn treatment is important. So the treatment of burns starts after stabilization, after the initial injury. Then their needs have to be assessed, the amount of damage has to be assessed, but most severe burns follow a very similar procedure. That procedure usually involves large doses of antibiotics to help fight infection. So probiotics are very useful in these cases because antibiotics tend to harm the gut microflora, the bacteria that live in the gut. And this is doubly harmful for burn patients in particular because they tend to have absorption and hyper metabolism, which means they need more nutrients. And if their gut isn't functioning well, that means they can't get as many nutrients. So probiotics help with burn treatment by mitigating the damage caused by probiotics, the treatment of burns. So here, I would like to talk about the medical management of severe burns. So after initial stabilization, the goals of severe burn treatment are to control the pain of the patient, to treat coagulation problems, prevent blood clots, to give antimicrobial antibiotic therapy, address hypermetabolism, and offer nutrition support. The things that I believe we, as nutrition people, should focus most on are the antimicrobial therapy, hypermetabolism, and nutrition supports. These are the three areas we can most directly affect, that being the antimicrobial therapy due to probiotics and ensuring gut health, hypermetabolism by ensuring adequate intake, and nutrition support just ensuring that whatever the patient needs to get the nutrients they need into them, we are helping them as best we can. So, the current challenges in burn treatment are the desire to accelerate wound healing, control infection, and reduce overall recovery time. And for the purposes of this study and for our background, we are going to relate all three of these terms. If you accelerate wound healing, you will control infection and reduce recovery time. Relatedly, if you control infection, you likely accelerate wound healing and reduce recovery time. Since all of these are related terms, the purpose of this study is therefore to address all three of these as best we can with the study of probiotics. And that brings us to the purpose of this study, why we're looking at probiotics. So the purpose of this study is to assess the efficacy of probiotics as a tool to accelerate wound healing and lower infection rates in burn injuries. So this is useful if it works because ideally probiotics would be able to address all three of those prior issues. If probiotics are effective, then that means they can, in burn injuries, lower the overall time to recover, they can lower the infection risk, and they can increase the rate of wound healing. So, the next stage of this presentation will be the definition of some key terms. So, probiotics are, in the popular lexicon, not very well defined. It can be anything from bacteria to fungi samples to products that help bacteria grow. So for the purposes of this presentation and this project, I'm going to be using the definition of probiotics proposed by Canny in their paper on the efficacy of probiotics, which is a probiotic is anything that is administered to any bacteria that is administered for a positive effect. So why are probiotics important? Well, probiotics are important for largely microflora uses. We're aware that the gut microbiome is very important to how we process food, how we absorb nutrients. So probiotics are useful in maintaining a balance to gut microbiome health, especially in people where gut microbiome may be damaged, either due to injury or, in the case of many burn patients, large doses of antibiotics. Antibiotics kill bacteria. The gut microbiome is made of bacteria, so probiotics can help maintain the gut. There is also evidence that probiotics elsewhere in the body, particularly in vaginal health, can help to maintain health elsewhere on the body as well. So the most common type of bacteria used that we're going to be discussing are the lactobacilli probiotics. These tend to be fairly banal bacteria. They don't cause harm or harmful infection in humans and are therefore a very good choice for a type of bacteria that can be administered to humans that is not harmful. So next, I would like to define some terminology relating specifically to burns that I will be using throughout this paper. So firstly, I would like to define the categorization of burns. So Stanford Medicine separates burns into three distinct categories. First degree burns are damage to the epidermal layer of skin. Second degree burns are destruction of the epidermal layer and some of the dermal layer. And third degree burns are destruction of both layers and potentially damage to the underlying tissue. Now, wound healing and infection rate, as defined by Go, are happen in 4 distinct stages themselves. The first being homeostasis, inflammation, proliferation, and remodeling. The ideal wound healing cycle will progress through all 4 of those as they overlap and interact with each other. The key to understanding wound healing and infection rate in burns is the attempt to ensure that the 4 stages are not impeded greatly. And the best, or one of the best ways to do that, is to protect the collagen synthesis and collagen remodeling stages of wound healing. And this is easiest to do if there is not a major autoimmune response to an infection in that area. So preventing infections is greatly beneficial to wound healing. And next I want to talk about silver sulfadiazine, or diazine, I believe. This is an easy to use, fairly painless, low cost, very commonly used topical treatment for burns. It is an antimicrobial treatment that helps to clean and sterilize wounds. It is very effective in this role clinically, but it is also very effective in research because it is a fairly cheap, easy to use substance as well as quite effective. It is often paired and used in trials when experimenting with burn injury and infection. In many of the studies I will present to you, silver sulfadiazine is used either as a control or in addition to a probiotic to determine the probiotic's effectiveness at wound healing. So now that I have established the purpose of this paper, I'd like to talk a little bit about the strategy behind it. So the first thing I needed to do when setting out for this paper was to develop a consistent and meaningful strategy to refine and investigate this topic. So I set about looking at similar systematic reviews in the similar field, specifically ones that deal with injury and probiotic usage that occasionally relate to burns, but not in all cases. And that led me to to adopt a similar strategy of looking through each database, refining exactly what I wanted from each database, and coming up with a better list of exclusion and inclusion criteria. So I did learn that through my first trial of this process that I needed to expand the amount of databases I was looking at. And therefore I used Deep Dive and Scopus to get a few more sources and a few more materials to look at. But I did then apply the exact same criteria as before in order to prevent any bias in my selection of those particular studies. The last, and I would argue most important thing I did to prepare myself was to learn some of the theory. This class helped a great deal with that, but I would be remiss if I didn't at least mention that a core component to my developing strategy and methodology is what I learned in this class through our textbook. So now that I have described a bit of my core search strategy and the development of this methodology, I should talk about the methodology itself. So the first thing I did was to search my databases, PubMed, EBSCO, the Booth Library database, Scopus, and Deep Dive for any and all articles that involve burns, probiotics, and wound healing in some way. I also limited the scope of this search to the last 18 years to make sure that all of the studies found were at least somewhat current and up to date. So I applied the PICO method to the studies I found. The PICO criteria I used specifically are problem must involve a burn of some kind. The intervention must be a probiotic. There must be a comparison. This is silver sulfadiamine or a control or both, and wound healing or infection rate in some way must be the outcome. So I then took all of these studies and filtered out all studies that were either irrelevant or non-primary, so secondary or tertiary studies, and anything that was just completely off topic. I then used my criteria to ensure that all studies fit all the criteria, and in the end accepted 12 studies into this study. And so this is a graphical representation of what I was just talking about. The article search was searching all of the databases, EBSCO, PubMed, Scopus, Deep Dive, for all relevant articles that were about burn injuries, probiotics, and wound healing or infection. And I got 567 total articles, 25 from EBSCO, 501 from PubMed, 4 from Scopus, 37 from Deep Dive. These were then manually reviewed by me for relevance. So anything that is off topic, irrelevant, not a primary source, were all removed, leaving 38 articles left. Then the PICO criteria was applied to ensure that all articles were not only about burn injuries, probiotics, wound healing, and infection, but all fit the type of study I was looking for. So things that had a burn injury as the population of studies, the intervention was a usage of a probiotic, whether it was topical or oral, and measured the outcome of wound healing or infection rate. In the end, there were 12 acceptable articles of that kind. Using the prior graph, it's clear that a method of organization was necessary in taming such a list. I employed the software Kadama and Zotero. Kadama is a software that helped me to organize all of my files and helped me to apply my criteria to each article individually very easily. And Zotero is an excellent method of ensuring all of the studies you are finding end up being recorded accurately. At the end of this process, I imported my data table into Microsoft Excel. The test for validity I selected for this particular study was the CRAAP test, or the CRAP test. This allows me to ensure currency, relevance, the accuracy of the source of information, the overall accuracy, and purpose of information is all clean, clear, and reliable. This is how I scored each, excuse me. Oh, heavens, excuse me. How I scored each individual study on the CRAP test. So Zhu was the oldest, and Perel is not that young, not that much younger, and so had to be docked points due to their age. And then the next 5 studies also were older than 5 years, so I docked them 1 point due to that. However, the rest of the CRAAP test did show a fair bit of reliability and accuracy among these tests. The data table you see here was set up to reflect my PICO. So study and reference year are to denote what study I'm talking about. The sample size is to denote the type of burn as well as the number of people in the given study. The intervention, all having to do with, probiotics and how they are used to treat. The outcomes were all measuring infection rate and wound healing. And the notes are there to help me discuss potential errors with each study, as well as potential control for errors with the study. So the first, Zhao et al., 2004, was a 30 adult with 30 to 50% of their body covered in third-degree burns. The intervention was glutamine dipeptide, 1 day of treatment, and 12 days of treatment overall. There was a control group present. The glutamine dipeptide is the probiotic used in this study. The outcome is the wound healing was shortened significantly. Infection rate was lower, but not significantly. This points to some level of agreement that probiotic usage, specifically glutamine dipeptide, has some utility as a treatment in burns. This is one of the stronger studies that was a double-blind and used parenteral nutrition as a method of delivery. Perel et al., 2009, was an 80 burn patient group. Both second and third degree burns were treated in this group. This one used lactobacillus or silver sulfadiazide. This was a study to determine the infectivity when treated with these 2 substances. The control was the silver diazanine, and the outcome of this was a decreased bacterial load and lower harmful bacterial load. Sepsis was not found in any of these patients, which points to a good clean trial without a lot of variance in it. The decreased bacterial load in this instance showing that, and the decreased harmful bacterial load, shows that the efficacy of the probiotic and intervention in this group, the sulfodiazanine and lactobacillus, were significant in lowering the infection risk of these patients. In Husseini, 2012, was my first animal trial. This tested 56 rats, and a Pseudomonas bacteria was tested against a control, and 5 different levels of kefir was applied to each group of rats. So kefir, which is a probiotic, showed that compared to control, there was a lower rate of inflammation and wound closure did increase. This was one of the studies that used sulfodiazanine, God, one day I'll be able to say that word, in its control as well as some of its interventions. Thompson et al. Was a case study about a deep dermal burn patient. This used Lactobacillus casei as the treatment in this patient, and the pathogen from the wound showed a change from a drug-resistant bacterium to a drug-sensitive bacterium, showing that there is some effectiveness in the specific case study that decreased the risk of infection of that particular patient. In Mays et al., 20 acutely burned pediatric patients were tested. There was a placebo and probiotic groups. However, no significant difference between the groups was found. However, the time to complete wound healing was shortened with probiotics. Also, the time to release from treatment was lower. This shows some agreement with the wound closure. However, this did not measure or find a difference in the infective rate of these patients. In Argenti, 38 rats were burned, 38 rats were burned rather. A control, there was Lactobacillus platyrium and Argosia, and both. The outcome showed that there was a reduction in mortality due to infection in the treated rats. There was evidence presented that the probiotics slowed the spread of bacteria in, quote, remote organs, or organs not directly affected by the burns, which is likely the reduction in mortality that was observed. In Egalazi, 40 burned pediatric patients and 20 placebo patients were given probiotic, 40 burned patients were given probiotic preparation. So that would be, a topical treatment with a probiotic. And it showed some agreement that infection was lower. 7 infections were noted versus 12 in the placebo. There was no mortality, and this was a randomized double-blind study. So there is little risk for bias in that particular study. In Satish et al., 2 rabbits had their dorsal fur shaved and 4 burns were applied to their back. They were then each given treatments for 3 of their burns. One was a control that was untreated, then one was given lactobacillus, another Pseudomonas, and one with both. And the outcome is a reduction in both the severity and length of infection to those areas. Excuse me. In Orion et al., 2018, 30 rats were burned, and a positive control group and a negative control group were made from those rats. A collagen scaffold and probiotic topical treatment was given to these burns, and the outcome showed an increase in wound healing on the rats. They followed up, Orion et al., in 2019 with a 12 burn rats, this time introducing kefir to burn wounds. This also showed a wound closure rate compared to control in all samples, although the degree to which that wound closure was measured was not consistent across all samples, just that there was some level of increased rate. The in vitro in the notes there, denotes that the bacterial load was tested, however, it was not reported to be significant. In my next study, we have 16 burn patients, a control, and 2 different types of probiotic for 14 days of treatment, and this did not show a significant difference in wound closure infective rate. However, they did show a slightly faster rate of exiting of the hospital. However, that was also not to too high of a degree. Excuse me, I'm sorry. A spider fell on me. So, Cermele et al., 2019, had 35 rats in 5 groups. The 7 rats for each group. There was a control, a lactobacillus, then MRSA, then lactobacillus, and then controls of 2 and 3. This showed that lactobacillus, then MRSA was MRSA group showed significantly less MRSA growth. 3 did not show that significance. This implies that the probiotic is a preventative, or the topical treatment slowed the initial growth and overall growth of MRSA overall. In Satish et al., 2017, 2 rats were burned. God damn it! The data collection methods of each of these studies were the total time in recovery, the bacteria load at various stages of, at various stages of treatment, the type and risk of the bacterias found in the wound, and the rate of wound healing overall. There is not a lot of agreement on the data collection methods between each study. The method of collection from each study was manually performed by me. Overall, there were 12 total trials. 5 were human trials, or had true human subjects. 7 were animal trials. 8 of the 12 trials showed some level of improvement in wound healing, bacterial load, or an improved type of bacteria. 4 of the 5 human trials showed some level of improvement in wound closure or reduced infection. While the wound closure generally improved, the degree of improvement was not consistent or agreed upon across trials. There was a wide variety in the studies I have found on this topic, both human and animal trials, but each trial, each study I found, was fundamentally unique. They did not have a through line on sample size. They did not have a through line regarding intervention or even type of intervention. Topical and oral antibiotic or probiotics were used. The level of control over each study varied wildly, from very clinical animal trials that were very strictly regimented to hospital trials that certainly had a degree of control, but were not done entirely in a lab setting. There was a lot of outside factors that influenced them. There were different types of probiotics used for each different study. Lactobacillus bacterium were commonly used, but there is variance in types of lactobacillus. There were differences in the measurement of data. Each study had different goals and measured different things, and there was not a very large consensus on what exactly the data should look like among all of my studies. This leads to a certain strength of my study, which is applicability. There being a level, albeit not a great level, of agreement among my studies does point to there being a relationship between probiotic usage and the reduction of infection and the lowering of wound time. It points to that relationship's possible existence. However, due to the great limitations of this study, that conclusion cannot be drawn very strongly at all. A large amount of more research is required to draw any kind of conclusion from this data set. So, due to the degree of difference of the studies used, only limited conclusions can be drawn. There is an apparent link between probiotic usage and burn recovery, or the magnitude of this relationship cannot be determined, and in fact, the link may or may not exist at all. We can only draw the broadest conclusion based on the data set. Excuse me. So, to give a brief summary of what we have just discussed, I gave a brief background on the importance of burn injury and the utility of probiotics in burn treatment. I defined a few terms that would be used, including the categorization, some of the language used to discuss wound healing and burn injury. I also discussed a couple of treatment options for burn injuries, including sulfur sulfadiazine, and I discussed the importance of probiotics. I then discussed the search strategy development process and methodology of the study itself, and I defined the PICA, which is the all studies must involve burn injuries and use probiotics as an intervention and measure wound healing or infection rate as an outcome. Excuse me. I then gave an overview of all studies and data collected, going through each study individually to try to establish a sense of the differentiation between studies. I then discussed the results of this data collection process. A discussion was held that explained the strengths and limitations of the study. Key limitations include, excuse me a moment, the variety in the accepted data. The purpose of this study was to assess the efficacy of probiotics as a tool to accelerate wound healing and lower infection rate in burn injuries. To this end, an effort was made to fulfill this purpose. However, the limitations weaken the ability to truly assess the efficacy of probiotics. The implications of this study mostly revolve around the need for more concrete data to be supplied, specifically in human trials, in order for a conclusion to be drawn about probiotics as a tool in burn treatment. And I have a nice long reference list to go over. So thank you very much for listening. I hope you have a wonderful week.